1 o'clock, so I think we'll start to kick off then, Joanna. So I'd just like to welcome everybody to our webinar, and this is being run jointly between Health Innovation Manchester and the Applied Research Collaboration in Greater Manchester. The inspiration for the event today was around the importance of quality improvement and why research is so important to that and why we feel it's the missing link. I'll just introduce myself first of all and my background. So my name is Bernadka Dubicka. I'm an Honorary Professor at the University of Manchester, the Medical Health Sciences, and I'm also a Child Psychiatrist in Pennine Care Foundation Trust. And I've got a background in research. And I'd just like to thank the trusts that have supported my research activity over the years, which has been really important in terms of progressing my work in academia, but also so important in terms of the NHS recognising the importance of research in terms of patient outcomes. Over the years, and particularly with the pandemic, there's a lot of concerns amongst us clinical academics that it's been much more difficult to try and support research within the NHS with all the pressures that we're currently under. And at the Royal College of Psychiatrists, we're currently submitting an editorial from a group of us academics just to highlight these concerns. So I think this webinar is really, really timely to show the excellent examples of research and practice and how that can improve quality improvement, but also how even though we've got very cash-strapped services at the moment with huge pressures, in order for us to deliver cost-effective, good clinical care, research is so important, and it's so important to invest in that. And before I finish, I think I'd just like to highlight a couple of other aspects of my academic work where I've really noted how important it is that we do have academics involved in quality improvement. So I'm the editor of the Child and Adolescent Mental Health Journal, and I get very many innovations in practice that get sent to me, and also quality improvement projects. And I'm very sadly, many of them just simply aren't fit to be published. And the reason for that is because people haven't involved clinical academics right at the very start. And so the methods just aren't robust, and the interpretation and conclusions just really can't be generalized. And so again, that's another example of how important it is for everybody that's here today who I know is interested in quality improvement. It's so important that we do engage clinical academics with all our quality improvement work in trusts in order to have outcomes that are meaningful and representative and can actually then be implemented in practice. I know there's very many people have signed up today from different professional groups across different organisations, and I hope that you'll all be inspired by some of the really excellent examples of practice that you'll hear about today, and also how it's so important in terms of increasing our workforce as well, that we do have opportunities for clinical academics and opportunities for everybody to be involved in quality improvement. Just in terms of housekeeping, we will have Q&A at the end of these 5 talks, and then we'll have a short break and then panel discussion later. If you have questions, please do put them in chat and I'll be monitoring those. And now I'll hand over to my colleague, Professor Sean Lewis, who will introduce himself and who will chair the first part of this meeting. Thank you.
Thank you, Bernadka. Hi, everyone. Thank you for coming to this. And this is very much Bernadka's idea, which is a fantastic idea. My main function here is crowd control, I think. So I'm going to be chairing, telling people to stop speaking after 15 minutes and things like that. My background, most relevantly here, is that I'm lead of the mental health domain, academic lead in Health Innovation Manchester, which is a sort of conglomeration between the NHS trusts, provider trusts in Greater Manchester and the University of Manchester, and the integrated care system in a big sort of blob called Health Innovation Manchester, which is all about innovation and delivery of research into practice. And I've also been R&I director of what's now Greater Manchester Mental Health Trust, and I've been chair of the Royal College Research Committee, and I've done lots of research around the country myself. And so I echo what Bernadka says about the potential impact of conducting research, not just about utilising the products of research, but actually conducting research on quality improvement processes in NHS trusts, by which I guess we mean these days? Improved patient outcomes, improved system performance, improved continuous professional development, all those things. So thank you, everyone. And without further ado, I'm going to introduce Professor Penny B, who works with and is standing in for Professor Karina Lovell. So Penny is very much involved in the ARC, which she'll explain about. So Penny, if I could hand over to you, and what I'll do is make myself invisible, and then my face will rematerialize in a threatening fashion after 40 minutes, if you're still speaking. So thank you very much.
No problem, thank you. Hello everybody. So as Shane said, I'm Professor Penny P. I'm based at the University of Manchester, where I'm a chair in applied mental health research, and I'm the deputy theme lead for mental health within the ARC GM. And that's really what I want to talk to you about today, and just give you an overview of what we do. So bear with me while I just share my screen, and then hopefully, is that coming up for everybody?
Yeah.
Yeah. Okay, so a little bit about who we are and what we do really. So you'll probably hear us talk a lot about the ARC GM, and that just is the applied research collaboration. It doesn't mean we have to do our studies in pairs, and we don't tend to work very well in floods, but hopefully the work we do is really helpful both to patient outcomes and to quality of care. So what does the ARC do? Well, in a sense, we have sort of multiple aims. Our aims are to undertake world-class applied research, but research that meets the needs of our local populations and healthcare systems. And that's really important for us. So we tend to work with our local partners quite closely, and a lot of those are here today. And we support the implementation of research and local evaluations for our allied health networks and other partners, and both in terms of work funded directly by ARC, but also supporting additional funding that comes through and work funded by our partners themselves. So we also work alongside those aims, and we try and develop and build research capacity to do this world-leading research and to use those findings across Greater Manchester. And in doing that, we also prioritise, as a lot of people do in their research, co-production and partnership working with public members and communities. We try and expand our approaches to that and develop innovative ways to do that. And I'll tell you a little bit more about that as we move through. A large part of our remit, I guess, is to address inequalities and ensure that our work reflects local needs. And our PCI partnerships are incredibly important in making sure we do that from the very beginning. So in terms of what the ARC covers, as I've said, I'm Deputy Theme Lead for Mental Health, but there's a few other themes that go on alongside that. So we've got a digital health theme, an economic sustainability, a healthy ageing theme, and an organising care theme. And all of us work together and across with our cross-cutting themes, which focus largely on methods or capacity building. So we have evaluation, implementation science, patient and community engagement, and workforce capacity building. So that's largely research with workforce capacity building. This is where we sit in the broader scheme of things. I know Shane's just talked a little bit about Health Innovation Manchester, and we have these different bodies around our local vicinity, and this is sort of how we all connect together. In a sense, ARC GM sits at the middle of this. And we connect with anybody and everybody. So we've got the Safety Centre, School for Primary Care Research, School for Social Care Research, CRNs, the Policy Unit for Older People, the Policy Unit for Health and Social Care Commissioning, the BRC, and of course the CTU as was. So we've got, I guess, a finger in a lot of pies, but hopefully a supportive connection with those groups, and that we get added value by bringing everybody together and working together over and above our own individual remits. So in terms of the mental health theme, what do we do? Well, we have a very generic aim, which is to develop, evaluate and implement new initiatives. And really what we're trying to do is both promote health, prevent ill health, and sustain and improve general well-being and resilience in our local GM vicinity. So we try and work with local communities, marginalised populations, and we've got a strong sort of equality and diversity theme running throughout the work we commission or contribute to. And within this ARC, we've got a particular focus aligned to policy, which is on focus on children and young people. So our key areas that we work with are prevention, access and integration. We work alongside, those are sort of conceptual themes, I guess, and we have a number of projects that I'm going to talk to you about in a minute that fit under those. Largely prevention at the moment has been children and young people, but we will be moving forward with more adult focused work as well. So just in terms of the types of things we do, or that you might hear us talk about or hear about. So when ARC started, we had a number of projects that kicked off as our early projects, and those include the following things here. So we do quite a lot of evidence synthesis and systematic reviews, and we've just completed our systematic review on parity of esteem. Looking broadly at what that is, we all hear about it day to day, but what actually is the definition of that and what indicators can be used in services to measure performance towards parity of esteem. We've got a physical health review led by Rebecca in GMMH in one of our local trusts. And we've also got another project linked to that further down, which is looking at physical health in CAMS. We tend to do a lot of work with our community partners, and we deliver a research methods course led by Karina that specifically targets PPI representatives or service users and carers who want to be more involved in research. And then we've got our PPI app, which is something I sort of briefly alluded to earlier in our innovative methods. And this is looking at whether we can engage patient and public communities to get involved in research through alternative methods to face-to-face. Often I think we all, we do PPI well in Manchester, but we often rely on face-to-face and small groups of reps who sort of are well experienced in research. And what we're trying to do with the PPI app, particularly around children and young people at the moment, is to just engage them in health research and try and get them included and their voices heard as well. So other projects are one led by our very own Bernadka, which is admissions far away from home. And then obviously in Pennine as well, we have an evaluation of the resilience hub. So all of those have ARC GM input in one form or another. New projects that we've taken on more recently are varied, as you'll see. So we have a project led out of Manchester, which is actually funded through RFPB. And that's looking at developing parental support strategies for families where a child has OCD. We're also doing evaluation of more research training, this time looking at trying to get some standards and processes in place for third sector organisations who want to do service evaluations. We've got a research methods course book that we published a while ago, and we're now adapting that for children and young people. Probably that's unlikely to be a textbook because of the nature of the population. And that's work that we want to do quite urgently, that we've kicked off just last week, to try and sort that so that it can support our work with children and young people moving forward. Sophie Parker, who's here today, I know, has got a study running in ARC, which is looking at responses during COVID. And then the Secure study as well is a social care study looking at the impacts on the social care workforce from the pandemic, which obviously is fairly topical at the moment in the news and general media. And then lastly, I've put the Sustain study, which is one that I lead with both the local trusts we work with. And that's one that has a long history in our department and actually stems from previous work in the predecessor to the ARC, which was the Clark. And that looks more at antipsychotic induced hunger in our local area. So I just wanted to, I know it's about, sort of thinking about how our research helps improve patient outcomes. And this is quite a nice case study to talk you through for that. Where did it come from, this study? Well, I guess it works on the remit that antipsychotic medications are really a mainstay of treatment for secondary mental health services. And those second generation antipsychotics that are likely not to disappear very soon do have some considerable side effects with relation to weight gain. So we know that roughly 4 out of 5 people who would take that medication will put on weight very quickly. And that can be up to 2 stone in the first year of taking antipsychotic medication. And that can continue and increase further for another 3 to 4 years. So that's quite a significant experience for people living with these experiences, really. Now, there's been a lot of basic science around this. There's a lot of rat studies out there that don't always translate to human studies. But what we do know is that there's both metabolic and behavioural influences. And I think where we're working in ARC is very much in the behavioural influence arena. So people who we've worked with in our public and patient involvement communities have said that the hunger they experience when they take antipsychotic medication is very different to normal hunger. And that partly contributes to changes in appetite and behaviour, which then contribute to weight gain. Now, obviously, that's got other connotations in terms of outcomes, cardiovascular disease, diabetes, heart disease. And actually what we'd like to do is to work with our local communities to try and find out whether there's a way of helping people cope with this hunger, for it to be better recognised in local services and for people to be given support to deal with that moving forward. So can we make an impact on patient and service outcomes by doing that? And that's, I guess, our driving research agenda for this project. So the project in itself is a mixed method study. At the moment, it's got 2 phases, which is to examine the context and experiences of hunger using evidence synthesis and qualitative methods, and to synthesize that data to develop with our public advisory panels a new intervention to support hunger management. We're hoping with additional funding to put a 3rd phase into that, which would obviously be the traditional kind of feasibility and full evaluation of that intervention, looking at the clinical and cost effectiveness and the effects it may or may not have. So at the moment, we're working to an 18 months timescale, the qualitative work in the next 12 months, and then the synthesis in the 6 months after that. And we're looking to recruit very soon participants who are aged over 16 who have commenced or changed their antipsychotics in the last 12 months. And obviously we will also be recruiting carers and health professionals to help those focus groups as well. So we appointed an advisory board, as we do with all our projects, and we are advertising at the moment through our existing forums and via trust intranets to appoint sort of 8 to 10 service users with experience of this hunger or antipsychotic medication who can help us really oversee the study from the beginning and contribute to key milestones as we move through, including that very important synthesis of the evidence that we collect and the development of the intervention. So I guess, how does the ARC help support research more widely? We have different routes that people can get involved in and different routes that might appeal to people today. So we have internships, and these are for clinicians who roughly spend about 30 hours with us, nested within one of our research projects. We have an intern working on Sustain, and just to experience that research process and to have involvement in that and to contribute to research outputs. We have opportunities for pre-docs, and the ARC provides funding for trust staff to spend 2 days a week preparing for a fellowship and an NIHR fellowship. And then within that, we also have our own ARC PhDs funded by the NIHR, and that money funds clinicians and academics to complete the PhD. And we have 2 PhD students within mental health at the moment who are in their first years, one working in public health and one working within an assessment of IAP services in primary care. So just new things that are happening as we speak, really. We've just received some additional funding for the mental health theme that's been really well received. And that's going to enable us to broaden our internship programme so that we have service user and carer interns as well. It's also going towards a community engagement event in Greater Manchester to raise awareness of the work we do and mental health research in particular. And as I mentioned earlier, we've got digital app development going on to try and move patient and public involvement a little bit more into inclusion, so that it's a lot more diversity and a lot more voices coming through. And that app development is quite complex and costly, and we can progress that a lot more with this new money. And then we've also been able to appoint, who we interviewed last week, a researcher with lived experience who will work on our SUSTAIN study, which is a really nice addition to our team. So that, in a sense, I haven't had shown jump out at me, so that's good. That's just really an overview of what we do, the type of things we do, both in terms of getting people involved in research, but also I think the type of research we do that impacts patient outcomes and service quality in Greater Manchester. So I'm aware it's a bit of a whistle-stop tour, and I'll leave it there. But if you do have any specific questions or you want to know more, please do get in touch and we'll try and answer those either today or outside of this session for you. Thank you.
That's great.